Evening, depending on when you are watching this video. Welcome to our channel. So today we'll be discussing, my name is Koti, your host on this channel. So today we'll be talking about convulsion in babies, the causes of convulsion, how to treat convulsion, what you should do when a baby is convulsing, and how to prevent convulsion in children. So number one, a baby's seizures happens when an abnormal extra burst of electrical activity occur between the neurons or brain cells in a baby's brain. This can happen for many reasons. Causes may include brain injury, infection, and underlying health conditions such as cerebral palsy. A baby's risk of fever-related seizure is highest when they are younger than 18 months. Sometimes it is difficult for parents or caregivers to notice seizures in babies and young children as they can be subtle. However, common signs include loss of consciousness and jerking of the arms and legs. For those of you who have seen people who are epileptic, you see that when they fall, they begin to jerk, move their leg, their body is tightening, their body is shaking, and before you know it, for children who are convulsing, you see that. And I noticed that from experience, children will convulse from 0 to 10 years, 0 months to 10 years. You see that their eyes will turn backward, and then they will begin to fume. And if you do not control convulsion from when a baby is small, like when a baby begins to run temperature, the first thing for you to do is to touch water on the baby's leg, lukewarm water or normal cold water. Touch the leg before you touch the head. If you touch the head immediately, you can give the baby a shock, or the baby or child a shock. So always use lukewarm water. Touch the baby's legs first before you wash the baby's head. Touch water, use towel. That is first aid while you are at home. But please do not allow a baby's temperature rise to 39, 38, 37. That's too much. The normal body temperature should be 35, 36 for anybody, both adults or children. So now, what are the signs and symptoms of baby seizure? The subtle seizure, you discover there are types of seizures, and most commonly in the newborn period. However, these signs may resemble usual everyday movement and may be difficult to spot. Symptoms of subtle seizures can include eye rolling, blinking, staring, uncontrolled eye movement, protruding tongue, legs cycling, long pause between breaths. So we have tonic seizures. Tonic seizures means muscle stiffness. When a baby experiences a tonic seizure, they may include completely stiffened. They may be completely stiffened. They will bend and hold their arms and legs in awkward positions. They keep their heads to one side. They keep their eyes to one corner. You discover that your baby's eye begins to go up like this and sink into the eye itself, so the eyeballs will sink in. So please always watch out for this kind of signs as a new mom, as a new mom. In fact, people who have been moms for 10 years do not still know this, so it's good to know it. Then we have clonic seizures. This means that twisting and jerking. So when a baby has a clonic seizure, they may display repeated uncontrolled jerking muscles movement. During these seizures, a parent or caregiver may notice the baby is clenching or twisting body parts. You know how the baby is just turning and doing like this? You know that baby is having a seizure. The best thing for you to do is to give paracetamol as first aid, or you begin to use lukewarm water or normal room temperature water to clean the baby's body and expose the baby. Let them wear only a diaper, or the child who is already big should wear only a pant. Do not cover them, no matter how cold they are. Do not cover them. You will discover also that the face, the tongue, the arms, the legs, the hands will begin to twist is in certain positions. Take note of this. It's easier to know seizures when the baby is already big than when the baby is still a little baby, a newborn or a toddler. So you watch out for this. Tonic clonic seizures. This refers to a type of seizure that starts with sniffing tonic phase followed by jerking clonic phase. Therefore, a person may observe symptoms of a tonic seizure followed by signs. So you know that, see, if once your baby runs temperature, please, every parent should have a thermometer at home. Have a thermometer at home and use it to check your baby's temperature. Do not allow your baby's temperature to exceed 36. Please take babies to the hospital. Do not begin to give excuses. So now, what to do during a baby's seizure? You say when a baby is having a seizure, it is crucial to keep them away from any hard object to reduce the risk of injury. When the area is safe, roll them into their side to prevent choking. You know how you take a baby to the side? Keep like the way you lie a baby to the side. Don't keep the baby on the back. Don't keep the baby lying flat on their tummy. Do not put anything in the baby's mouth or try to stop any mouth movement such as tongue biting, as this can injure the baby. See, like I used to tell people, the best thing for you to do when the baby is convulsing, God forbid, is not your portion, but when the baby is convulsing, use your palm and put in between the baby's teeth or the baby's gum for those who are newborn babies, so that the baby will not get into a place where the baby will lose their life, because convulsion can kill. It can also cause epilepsy. When a convulsion is not treated or is not handled properly, when a child clocks 10, the child begins to be an epileptic child. So that's why it is good to see a neurosurgeon when your child is already convulsing. It's usually good to see a neurosurgeon so that they will know what to do to help that child. Then another thing is, do not put anything in the baby's mouth. Okay, I think I said that earlier. And that thing is, call the doctor. Go to the doctor. They say they will struggle with breath. Their eyes, they'll begin to turn blue. The children will begin to turn blue, experiencing symptoms for longer than 5 minutes. The best thing for you to do, like I said earlier, use your palm, put into the baby's teeth so that the baby can bite it. Sorry, the child can bite it, or the baby gum can bite on it. Are seizures common in babies? Seizures are the most common neurological emergencies in the first 4 weeks of a baby's life. As many as 1 to 5 babies per 1,000 experience a seizure. Some seizures only last a few minutes and occur once, leaving no lasting damage. When a baby experiences frequent seizures, they must receive treatment to prevent brain damage. Like I mentioned earlier, I talked about a baby having a child having epilepsy, so we need to be very, very careful. As mothers, as fathers, we need to be careful. He said that when a baby experiences frequent seizures, they must receive treatment to prevent brain damage. Brain damage occurs due to the frequent disruption of brain oxygen levels and excessive brain cell activity. When a baby is convulsing, the brain will not take in enough oxygen because it's being obstructed. So that's why you see that a lot of children need to see neurosurgeons. You need to meet a doctor who is a neurosurgeon so that he can help you with this. There are other exercises that will need the baby to do or the child to do. Is it a seizure or a reflex? Sometimes when babies show signs of seizures, they are demonstrating healthy reflexes, so we should take note of that. And then another thing is that the moral reflex or startle reflex is a healthy part of baby's movement. If a baby hears a loud sound or sense a sudden movement, they may throw their head back and suddenly twist and extend their arms. Parents or caregivers should not worry when they notice these behaviors. Babies tend to outgrow these reflexes from 3 to 6 months. So, you guys, when you notice that your child is having these reflexes according to sound, do not even worry. Then the tonic neck reflex. The tonic neck reflex is a movement where the baby looks to a side with one arm extended and the other bent. It may look like they are imitating holding a sword or flaming or an arrow. The primitive reflex first develops in the womb and helps the baby coordinate their eyes and control their movement. So it is very important that you check your babies, check your children. Whenever your child runs a temperature, like I tell people, the traditional way to do it, just get them scent leaf, wash it well, squeeze it, and give them to drink. It will drop the temperature. But please go and see your doctor. Go to the hospital so that they can, and please always have paracetamol at home, which is the first aid for little children. And you too, when you run a temperature, see a doctor. Do not do self-medication. See you guys in the next one. Please subscribe and share this video. It will help a new mom and an older mom. Bye.